myself Dr. Jyotirmay Hegde. I'm the lead consultant and head ENT at Aster Hospital, Whitefield. Today I'll be talking to you regarding sinusitis. So in layman's term, we keep hearing sinus. It's so common. So when it comes to sinus in regards to ENT, the most common thing which we relate is related to cold, nose block and headache. And when we see the reasons for sinusitis, the most common thing is allergy. So allergic rhinitis, allergic sinusitis, which in turn leads to nose block, cold, allergies, sneezing, headache is very common. Apart from allergy, the other reasons being deviated septum. It's an anatomical thing. There is a partition in the nose between the two nostrils which is supposed to be in the center, which gets deviated, and it's called deviated nasal septum. Because of which the airflow in the nose is not good enough, there is blockage, and that leads in turn to sinusitis. So what happens in sinusitis? Basically, why has nature or why has God given a sinus? That is mainly to keep the head light in literal sense, because we have the brain inside and so many other organs wherein which can make the head heavy, and every day when you walk you may feel my head is so heavy. To make it light so that you don't feel any other problem, the sinus has been made by the nature. So whenever the sinus is normally there, it is supposed to have only air. Other than air, it should not have anything, basically to keep the head light. So what happens when you have any allergy or a deviated septum or any other causes wherein there is accumulation of the sinus with fluid, that is, it's called mucus, or it may lead to pus, or there may be mass inside which is called as polyps. All these things lead to heaviness of the head. So basically those who have sinusitis most commonly complain of heaviness of the head. It may be one-sided headache, dull, boring kind of headache in long-standing sinusitis, which we call in medical terms as chronic sinusitis. Or maybe it may be a very severe headache, an unbearable kind of headache, severe fever, which is in case of acute or short-lasting sinusitis. So whatever the reason is, whether it is because of allergy, deviated septum or any other reason, and whether it may be acute or chronic sinusitis, the ultimate aim is to manage the sinusitis. So how do we manage sinusitis? If it is a case of short-lasting or acute sinusitis, we have to manage initially medically. We have to treat it with appropriate anti-cold medicines, decongestants which avoid the nasal blockage. Home remedy will be like steam inhalation with some eucalyptus oil or commercially available decongestants. And if it is gone beyond that stage into infection, we have to give antibiotics after thorough examination in the ENT consultation. And that is how we manage a case of acute sinusitis. If it is something case of chronic sinusitis, which is usually because of allergy, dust, pollution, deviated septum, in such cases, first we have to try to find out why is the sinusitis happening. For that, first you need to come to the ENT consultation. We see you and we find out what has gone wrong in the clinical examination. Once we find out what is wrong, to support it or to see whether how much is the deviation, what could be the cause, we may ask for additional investigations like DNA, that is nasal endoscopy, or we may need an X-ray of the sinus, or we may need a CT scan of the nose and sinus, sometimes an MRI, based on what is the relative cause. And once we use these investigations or tools which are available for the diagnosis, we come to a diagnosis. Based on the diagnosis, we have to treat, which can be either medical or surgical. Medical may be again decongestants, nasal spray, antibiotics, or whatever depends on what the cause is. If it's something which cannot be managed medically, we may have to go in for surgery. We go minimally invasive transnasally through the nostril with the available instruments like endoscopes. We mean some complicated cases we may require like navigation, wherein we have to correct the pathology in the nose. So for that, you may require basic surgery like septoplasty, or in some cases, if it has gone too much inside the sinus, you may require endoscopic sinus surgery. So these are all the facilities which are available in the toolkit, and depending on what is affecting you, that has to be treated appropriately.